Hello, this is Janet Michael. In addition to hosting The Valley Today each weekday at noon on the River 95.3, I also produce podcasts, and I'm excited to introduce you to a new podcast series in partnership with Lord Fairfax Community College. Having provided higher education and career training for the past half-century, LFCC is tightly interwoven into the fabric of the Northern Shenandoah Valley and Piedmont regions. Join me every week for conversations with current and former students to hear their funny and inspiring stories as we learn about their journey to higher education, the role that LFCC has played, where they are now, and where they plan to go. We'll also talk to current and former professors about their experiences and best memories of LFCC over the past 50 years. Get every single episode as they're released on our website at theriver953.com under the podcast tab, or you can subscribe for free in Apple Podcast, Google Podcast, on Spotify, Amazon Music, wherever you listen to podcasts. Just search for LFCC Stories. Hello and welcome to The Valley Today. I am your host, Janet Michael. Happy Monday as you are listening to the show today. We, however, have pre-recorded our conversation late on a Friday afternoon, so I am extra grateful to my guest today. Robbie Kidd is on the Zoom screen with me. He is a Shenandoah University professor and Chair of Pharmaceutical Sciences at the school. And Robbie, we're going to talk about an interesting topic. Becky sends me all of the press releases from Shenandoah, and I got this one last week about pooled saliva testing at Shenandoah University. And at first I thought, oh, okay, it's just another way to test. And then as I was reading the press release, SU is one of only a few universities that are actually doing this test. So tell me what it is.
So what's a little bit unique about what we're doing is the pooled part of the saliva testing. There's a lot of universities as well as clinical labs that are testing for the coronavirus in saliva. But when we were developing our method, we were really looking a way to make our process as efficient as possible so we could test as many as people as possible. We sort of have limited resources with the labs that we have here. And as I'm sure you're aware, there's a shortage of testing supplies across the nation and across the world. So we were trying to also be as efficient as we could with the testing supplies that we could get. So the pooled part of testing that I'm sure there's more, but I know of a couple. So Stanford and Syracuse are both doing pooled saliva testing. So we joke that it's the universities start with S are doing pooled saliva testing. But what we do is we're collecting saliva from faculty, staff, and students. And then instead of testing each one of those samples individually, we pool up to 5 of those samples together. So in other words, we combine those together, and then we run a single test for the coronavirus. So what that allows us to do, and I'll give you an example from today. So we had 101 samples that were delivered to us this morning about 9 o'clock. So we pulled those into, if you do the math, we actually had 21 pools. And so we did 21 tests. And so luckily today, none of those pools came back positive. But what would happen is if one of those pools came back positive, then when we would go back to those, we don't pull all of the saliva initially, we just pull part of it out. So we still have the original saliva from those original 5 individuals. So we would go back to those 5 individual samples, then run an individual test on each one of those to identify which person in that pool was positive. So if we do the math on that, so let's say we're doing 100 people, we initially run 20 tests, then we have 1 positive pool come back. We have to run 5 more tests. So we ran 25 tests. So we only used the supplies needed to do 25 tests as opposed to the supplies needed to do 100 tests.
Which is amazing when you consider how much time you're going to save in addition to all of the supplies that you're going to save. What's the turnaround time on the test results?
Well, so I kind of described 2 different processes. So today we didn't find any. So I was giving an exam at 1 o'clock. So before I gave my exam at 1 o'clock, I had actually emailed the results back. So that was less than a 4-hour turnaround time. Now, obviously, if we got a positive result out of that first run, it's going to take us a little bit more time to go back and do the individual test results. So on a typical day, if we get samples about 9 or 9:30, by 3 or 4 o'clock, we'll report the results back so the university can go ahead and call that student in.
And how are you determining who is giving the samples? Are you just rotating through all of the students and staff and people on campus? Are there any kind of prerequisites that need to happen for somebody to participate in this type of testing?
Yeah, that's a great question. And I can tell you a little bit about that. I'm more on the testing side of it. They deliver the samples to me. But Mitch Moore and his team, Jenna Steele, are primarily involved in identifying the people to be tested. So the way it works is they'll identify who all they want to test in a given week. They'll send out emails to all those individuals, tell them on what day and at what location they need to show up for testing. Or we also have testing kits put together that people can just grab and then return. So we're trying to do it across the university. On occasion, we'll do kind of focused testing. So if we think there's a concern with a sports team, or if we think there might be a concern with a certain group of students. I don't think we've done this, but you can imagine if there's a concern about one particular dorm, then we can focus our testing on them.
And I would imagine it's a whole lot easier to convince these students to do this pooled saliva test than it is the other normal method that we see. Have luckily, I'm a knock wood, have not had to have a COVID test, but they look not just disgusting, but they look a little painful. So I would imagine spitting into something is a whole lot easier to convince a student to do.
And that was one of many reasons why we selected saliva as opposed to a nasopharyngeal swab is what you're referring to, sort of the standard method. That if a nasopharyngeal swab is done correctly, it's probably going to bring tears to your eyes.
Watching it was bringing tears to my eyes when they were showing some of it on the news as they were doing some of these drive-by clinics and things like that. So, and you guys have really been you've been doing this for a while. I mean, I just got the press release about it last week, but you started implementing this in September when students returned to campus, right?
So we started doing our testing the second week of September. We contracted with another company because we didn't have our method fully up and running and validated when students first came back to campus. So what we did when students first came back to campus is all residential students, while they were moving into the dorms, came through and they actually gave a nasopharyngeal swab sample. So I think that was one of the things that really helped Shenandoah as a university keep our case numbers down, is we knew from the very beginning that we're doing, particularly at that time, relatively good in the Winchester, Frederick County, Clark County, this northern Shenandoah Valley area. What we were concerned with is we have students coming from all across the nation, really all across the world. So the concern was not that they were going to get infected when they came here, but they could potentially bring the infections here. So we wanted to screen all those students initially. And so don't remember the exact number. It was about 15 that we identified right off the bat, got those students in isolation. So if you think about the potential numbers, if you've got 15 on day one, on week 2, you may have 50. On week 3, you may have several hundred from that small group that we were able to identify right off the bat. So I think we were very fortunate, very kind of forward thinking in doing that.
And I remember the conversation that I had with Mitch several weeks ago, back in September, actually, when they were waiting for students to come back. And they were very cautious and careful because at the time on the news, other colleges across the country were having students come back, and then they were having these huge positive test rates, and they were sending the students back home and back into their communities. And Mitch was very clear that that's not what we want to do. Part of what they were converting the old Lee Jackson, the Clarion Hotel, for was kind of a solitary confinement of sorts for those positive tests. So I really do commend everybody on keeping them on campus and getting them through the 2 weeks or 3 weeks that it takes to come out the other end.
Yeah, that's exactly right. That's the last thing that you want to do, is have an outbreak on campus and then send everybody in 1,000 different directions back into 1,000 different communities and cause your local outbreak to then become a very large outbreak in many other areas. So what we've done, and a lot of institutions are doing it, is set aside dedicated space that we realized from day one in every institution that opened up for face-to-face instruction is we're going to have cases, just like we're going to have cases in Winchester, and we're going to have cases all across the nation. It's how do we deal with those cases when we have them. So we have space set aside, and the only problem would ever arise at an institution is if they started to exceed the number of cases that they had with the space that they set aside. That's where you really get into trouble. So again, fortunately, with our relatively low numbers, we've not even come close to exceeding our space, where we would have to consider other options.
Now, I'm assuming that these tests are being analyzed at the Dunn School of Pharmacy. Can we take a quick commercial break and come back and have you kind of explain to me the role that the pharmacy school has played in the whole COVID-19 thing, and specifically with testing these results?
Absolutely.
Okay, we're going to do all of that in just a couple of minutes. Again, we are on the Zoom screen on a Friday afternoon having a conversation with Robbie Kidd. He is Shenandoah University professor and chair of their pharmaceutical sciences. We're going to be back in just a couple of minutes to continue this conversation.
Do you know anyone who is struggling with financial hardships because of coronavirus? Our new webinar called Coping with the Money Crunch can help. We'll talk about immediate options to consider, revising or creating a spending plan, and lots of community resources. Then we'll cover how to narrow your priorities, contact creditors, and avoid scams and risky loans. The webinar is free, and you can either join by phone or through Zoom on a smartphone, tablet, or computer. You can find out more by visiting the Northern Shenandoah Valley Financial Education Program on Facebook or calling Karen Poff at 540-635-4549. Let me show you how to make your own plan or help someone you care about get through the crisis. Call 635-4549 or visit at NSV Financial Education on Facebook today.
Welcome back to the Valley today. I am your host, Janet Michael. Happy Monday as you are listening to the show today. We, however, have pre-recorded our conversation on the Zoom screen on a Friday afternoon. We are chatting today with Robbie Kidd. He is Shenandoah University professor and chair of pharmaceutical sciences. We have been talking about their pooled saliva testing that they have been performing on their students and on staff at Shenandoah University. And Robbie, we were talking before we went to break about the role that the pharmacy school has played in this testing. So what exactly has that role been like?
It's been interesting, that's for sure. I guess I could back up and kind of tell you how it got started. We knew really from the beginning of the pandemic that we had the capabilities to do testing for the virus, that a PCR test is something that myself and several of my colleagues have been doing here at the School of Pharmacy for more than 20 years. So the problem was that our labs are really set up for what the technical term is research purposes only, as opposed to what you normally think about when you go to the doctor's office or you go to the hospital. You get what's called a diagnostic test. So we could do research testing, but we couldn't actually report results out as diagnostic testing. So what happened in August is Center for Medicaid and Medicare Services updated guidelines, realizing, I think, that particularly lots of universities had a huge capacity to do PCR testing, and we weren't utilizing that because of a simple little guideline that was in place. So what CMS, Centers for Medicaid and Medicare Services, came out and said is, due to the pandemic, we can do testing for the coronavirus in a lab that's not CLIA certified. And that's just what CMS gives as sort of the certification for a diagnostic lab. With one caveat, we cannot report a diagnostic positive result. So using their language, what we do is when we find a positive, we call them a presumptive positive. And then we refer them to diagnostic testing. So the examples that I gave you earlier, if we do our testing, we find a positive pool, then we identify one individual in that pool. We call them a presumptive positive, and then we refer them to diagnostic testing. When that diagnostic testing comes back as positive, then all the normal processes happen. It goes to Virginia Department of Health. We can do contact tracing, isolate that individual, etc.
Now, are there students, are these pharmacy students that are actually performing these diagnostic tests? And wow, what an education they're getting. They probably never expected to.
I do have several students that are very interested in getting involved with our testing. Since we're potentially dealing with infectious saliva, we haven't gotten students involved in the process yet. So there's 3 faculty members right now that are doing the testing, and we're going to expand that starting in 2 weeks to add 2 more faculty members as part of our scaling up of the number of samples that we can test in a week. We're currently testing about 400, have a capacity to test 480 people per week. We've got plans to move that up to a capacity of testing about 1,000 people per week.
Wow. So you're going to get even busier. It's a good thing you mentioned at the top, we were talking before we started recording that you had just finished up an exam. It's a good thing this is exam week and you're getting those out of the way for now.
Exactly.
Do you have a lot of students, though, that are coming to you and saying, hey, I want to be a part of this, and kind of are a little heartbroken when you say, look, it's a little not quite safe enough yet for you to participate?
So I'll tell you how it started is I mentioned the university tested with an outside contractor all the incoming residential students. So in a very short period of time, we needed to validate our test. And so I saw that opportunity there as we were going to have about 1,000 students that were going to get swabs taken, and we have a diagnostic test result from them. So in about 3 or 4 days time, I mobilized, I think it was 6 students and 1 other faculty member, and we got everything together to, while they were collecting the nasopharyngeal swab samples, we got the students to come by and give us a saliva sample. And so then we could match up the testing results that we did on the saliva to the diagnostic test as a way of validating our study. So when I first offered it as an opportunity for students to get involved, within 3 or 4 days, I had a half a dozen ready to go. And since then, more have approached. I will tell you, we're looking at ways that before we ever even open that tube, that we can completely heat inactivate the virus, but still detect it. So once we get that method finalized, I'll be more comfortable bringing students into the lab and working with samples.
Well, and it's important to mention too, because I've heard about it on the local level, and I'm not sure how many people realize this was Shenandoah University's largest incoming freshman class. I'm not sure if it's ever or in quite some time. So there were a lot of brand new students coming on campus this year.
Yeah, I think, I'm not sure about the freshman class, but I think it's the largest number total incoming class. So that includes freshmen, graduate students, transfer students.
And we didn't talk much about this in the first segment from a testing perspective, but this is a great test because you're looking for asymptomatic people because they are just as capable of spreading this virus as people who already have symptoms. And this is why this is important, so that you can get ahead of that curve.
Exactly. So there's a system in place for everybody, anybody across the country, that if you're symptomatic, you can go to your doctor and you can get a test done. What's not in place in most places is a way for asymptomatic people to be tested. And the numbers really are kind of astounding. So in the overall population, it's estimated that 40 to 45% of people that have the virus and can infect other people are completely asymptomatic. My guess is in our college students, normal, young, healthy, it's probably even a higher percentage than that. So that was part of the design of our system, is we're trying to develop a way to identify a group of people that aren't currently being identified through the normal healthcare system because they are symptomatic. And we knew based on our population that we were likely to have a higher percentage of those too. So yeah, it really is interesting the way that we go through, and people that have zero symptoms can have very high viral loads.
And do you think that there is a possibility? I mean, we're hearing talks about the vaccine, but we're hearing middle of next year, potentially even the end of next year before it's widely distributed. Do you think there's potential for Shenandoah to be able to start offering some of these to the public instead of those on campus? Or is this going to have to stay a campus only type of test because of the diagnostics and the rules that are out there?
Yeah, that's a really great question, Janet. That's something that we've kind of played around with a little bit right now. At this point, we feel we might be getting into a little gray area if we started testing outside of the Shenandoah University community, but that's something that we can look into. The issue right now that we have is the Shenandoah University community, as you mentioned, is so large with our largest incoming class, that we would really like to be able to test even more within our community. And so we've just got a limited number of people and a limited number of machines that we can actually do this testing. We would love to be able to help out the larger community, but I tell you, I feel that we are helping the larger community too by limiting the spread within the Shenandoah community, limits the spread everywhere in the area.
Well, and the one thing we didn't mention earlier, we talked a lot about freshmen coming on campus and the students that are living there in the dorms. But because we are so centrally located here in Winchester, and Shenandoah has such a great reputation, you have students that live in Fairfax, that live in Northern Virginia, where their numbers are a lot higher than ours, that are commuter students, that you also want to make sure they're not bringing it with them and that we're not sending it back to them as well.
That's exactly right. And we also have satellite campuses in Fairfax and in Loudoun County. And to be honest, to date, we haven't tested out there, but we do have plans now in place that we're going to start testing for both our Scholar Plaza Loudoun community as well as our ICPH Fairfax community.
When does this semester end? I mentioned a second ago about exams. When is this semester over?
The last week of classes is the week after Thanksgiving, and then final exam is the week after that.
And then is the assumption that everybody will go home for Christmas break and then come back and start this whole process all over again?
That's the assumption. So this time when we start the spring semester, instead of contracting out to do the testing as students are coming back on campus, that we're going to do that ourselves this time.
And you'll be ready to go because you've already got all of your systems and mechanisms in place.
It'll be a busy beginning to the semester, but yes.
Well, thank you, Robbie, for taking some time to explain all of this to me. I kudos to Shenandoah. I mean, I had no doubt that you guys were going to do well with what you had in place based on what Mitch had told me back in September, but I am really glad to see that it has worked out exactly the way that you guys had hoped, and you've been able to keep your numbers low. And I think it's really cool that we're one of just a few college communities that have these capabilities.
Yeah. Well, thank you very much, Danny. It's been my pleasure.
We are going to wrap up our conversation today. We have been chatting with Robbie Kidd. He is a Shenandoah University professor and Chair of Pharmaceutical Sciences. Tomorrow is Tourism Tuesday, Shenandoah County edition. So Carrie Hahn is going to meet me on the Zoom screen. I'll have that show ready to go for you just a few minutes after noon. Meet me back here then.